When you're selecting your CME provider, one of the things that's important is that you're dealing with a reputable institution who is going to be an institution that is going to be sourcing guideline-directed therapy on the one hand and evidence-based therapy, because there's so much craziness out there about medical information that's not scientifically sound. So one of the great things about Oakstone is they have these partnerships with, for instance, Harvard Medical School, the University of California, San Francisco, NYU Medical Center in New York University, Brigham and Women's Hospital, and the list goes on. And these are really the top-notch medical institutions in the United States. CME requirements vary depending on the institution you work for and the state you live in. Those expectations are given to you by the institutions that you belong to. So for instance, the teaching hospital that I'm on staff at here in Metro Chicago area, they require not only that all their doctors be board certified to even join the staff, but they require that you get 50 hours a year of CME credits, and you have to be ready to prove that at the end of every year that you have those certificates and that you've put in that time. And that is a higher bar than that. Teaching hospital has a little higher bar that you'll find some other places. Some states, as you may have heard, for relicensure have requirements like that you, let's say, get 25 hours a year, for example. States vary tremendously in the quality of what they expect of their physicians. And that sometimes I believe that correlates with public health statistics in those states. That goes a little bit according to where you are across the spectrum of training in your professional career. So let's see if I can quickly kind of separate it into three categories. You know, there are newly minted physicians who've come out of training programs whose head is just full of all kinds of knowledge, but maybe are looking to pass their boards or maybe have just passed their boards. And then they're trying to retain and amplify on things that they've learned coming out of the training programs. On the other hand, there are doctors who are, for example, 5 years to 15 years out from their residency or fellowship program, who need to have some way of making sure that what they learned before hasn't become stagnant or obsolete. And so that will increase as time goes on. So they can't sit on their laurels. They have to go back to what I referred to before, is to be really top-notch physicians, to be lifelong learners. And fortunately, many of our institutions, our medical schools and training programs are trying to emphasize that to our young physicians. And then the third group, I don't want to forget the third group, are probably physicians who are 20 or more years out from training. And those doctors in particular, from things that I've seen, have a need to make sure that they're staying current. And there are a variety of ways of doing that, but there are many practice-changing insights and studies that question things that we used to regard as sort of the holy grail years ago in training. I think somebody once did a study and found that over, let's say, 20 years of serving as a medical professional, probably about 50% of what you learned in medical school and residency has become obsolete over that time. And it's very important for physicians who are astute and trying to do their very best that they realize that limitation, and they make a commitment. As they make a commitment to again some sort of involvements that are going to make sure that their knowledge is not becoming stale, and their recommendations and prescriptions to patients is not becoming stale. Physicians need to become flexible and question whether they know it all. You know what I'm saying? So being able to check in on your knowledge and test yourself with certain things is very helpful. And that's where these kinds of programs come in, because I would tell you, from having gone through the, for instance, audio companion series in internal medicine, I've been startled many times where I thought I knew the answer, and the best answer has changed over time. So this is something that I think is a realization and an aha moment for a lot of physicians, particularly as time has gone on in their careers.